Welcome to State of Mind, Being Human and Living Well, broadcasting on KSQD Santa Cruz on 90.7 FM and live streaming at ksqd.org. I'm the producer and host, Deborah Sloss, licensed marriage and family therapist. In today's show, we'll be learning about mental health crisis services, how they work, and how to be prepared in order to have your experience of using them go as well as possible. Our guests will also share their personal stories about what it was like for them using these services. While most of us don't expect to ever need to use mental health crisis services, statistics tell us that many of us will, in fact, have to at some point, either for ourselves, a family member, friend, or work colleague. Information on the Centers for Disease Control website, updated just in November 2020, indicates that last year there were 4.8 million visits to emergency departments with mental disorders, behavioral and neurodevelopmental issues as the primary diagnoses. And with 1 in 5 adults and 1 in 6 youth in the U.S. living with a mental illness in the moderate to severe range, the need for robust mental health support systems and being prepared in how to use crisis supports are crucial. Today, we'll be learning more about the systems currently in place here in our community and how to best access them. Please forgive any sound quality issues in this recording, as we're all recording from remote locations due to the coronavirus pandemic. Today, we're so fortunate to be joined by two guests, Jennifer Wentworth and Kathy Pereira, who have direct lived experience with using mental health crisis services. And also with us is James Russell, a mental health professional and crisis response specialist working with the Santa Cruz County Sheriff's Department. Let me tell you a bit more about our guests today. Jennifer Wentworth has been a Santa Cruz resident most of her life. She lived with mental illness and is diagnosed with bipolar disorder and PTSD. Jennifer has been a peer speaker for NAMI Santa Cruz County for over a decade, speaking to community and school groups about mental illness. She's also worked with the American Foundation for Suicide Prevention and Mental Health America. As a mental health advocate, she's spoken to state legislatures about bills that affect persons living with mental illness and has received awards for her advocacy work, including several from the Santa Cruz City Mayor and the State of California State Legislature. Jennifer maintains an active mental health recovery blog called A Day in the Life of Being Bipolar, where she shares her experiences and knowledge with others about living in recovery from serious mental illness. Kathy Pereira was born and raised in Santa Clara, California, the middle child of 13 siblings. Kathy married and then went on to have and raise 2 healthy sons. She struggled with postpartum depression after each child's birth. It was extremely difficult on the family and herself, but eventually Kathy was able to learn ways to support her mental and physical health. In his teenage years, one of her sons developed schizophrenia. She found it devastating, not knowing where to turn for support. But Kathy and her husband began the journey to find medical help and to become educated on the illness. NAMI's Family-to-Family course was a valuable resource because they learned new ways to communicate with their son, as well as meeting other families with similar situations. After moving to Santa Cruz 6 years ago, Kathy continued to look for support at the local chapter of NAMI and realized that she was now ready to help other families and friends of a loved one with a mental health condition. As a NAMI volunteer, she continues to share her lived experience in hopes to help others find resources and support. James Russell is a licensed marriage and family therapist working for Santa Cruz County Behavioral Health. Within the county, James has worked in a variety of crisis response positions, including assignments as a mental health liaison working with law enforcement, with the jail crisis team, and as a supervisor and now program manager for the forensic behavioral health teams. James assisted in starting and implementing a local crisis intervention team training program for local law enforcement and continues to be a trainer and advisor. Additionally, James is certified as a mental health first aid trainer on the crisis negotiation team for the county sheriff's office and is one of the county's 5150 certification trainers. James has personally responded to and met with numerous Santa Cruz residents in crisis situations. We are so honored to have these fine folks with us here today, and each of them comes with so much rich experience to share on this topic. So welcome to State of Mind, Jennifer, Kathy, and James.
Thank you.
Thank you. It's good to be here, Deborah.
I'm thinking we'll start with you, Jennifer, and wondering if you could share some of your story about how your life has been affected by mental health issues and, specifically about your use of mental health crisis services.
Yeah, absolutely. I was receiving mental health treatment from Santa Cruz County Mental Health Department for probably over 10 years. I am diagnosed with very severe bipolar disorder type 1 with psychotic features and post-traumatic stress disorder. Before I had the right diagnosis and treatment and support, I was constantly utilizing the crisis support system in Santa Cruz. I grew up not really having supportive parents. They were uneducated about mental illness, and unfortunately that delayed my treatment. I had my first suicide attempt when I was 21 years old, and I ended up at Dominican Hospital in the behavioral health unit, and that was my first experience accessing crisis services. And at that time, I was having a psychotic bipolar depression episode, and it was the first time I was given psychiatric medications, and I went on and on for the next 10 years with very extreme manic episodes, having psychotic manias, and frequently calling 911. And the Santa Cruz County Sheriff's Office over those 10 years was very familiar with me. I had been hospitalized over 150 times, and many of my manic episodes had delusions and paranoia, and had a lot of issues with law enforcement being involved. I thought that at certain manic episodes that the Mexican drug cartel was after me. I thought that demons were attacking my body and that my free will was being taken from me. In some of the good manic, well, good, I say good, they're not really good, but they feel good, having experiences, hearing voices, and they were telling me that I was Eve from the Bible and tell me to take off my clothes in front of people. And so after being in the hospital, I was introduced to treatment, and my caseworker or my coordinator and my psychiatrist helped me kind of get some treatment. Unfortunately, it took at least that 10 years to get the right diagnosis, because first it was depression I was diagnosed with, then schizoaffective disorder and disorganized schizophrenia. So those are some of my experiences. Now I have the correct diagnosis, but that's some of my experiences being involved in the mental health system and going through these manic and depression episodes with psychosis.
Unbelievable what you've been through and that you're here talking with us about it today. Just really appreciate that, Jennifer. Kathy, can you share with us also some of your story about how your life's been affected by mental health issues and what your experience using crisis services has been?
Sure, Deborah. My husband and I married about 40 years ago and started raising our kids, or having kids 35 years ago. And after each child, I ended up with postpartum depression, which the main symptoms were anxiety and panic attacks. And it was really difficult on the family. It was difficult for me. I really had no one else in my immediate family that had gone through anything like this. And I was pretty much forced to start educating and learning about why I was going through this and reaching out to different doctors and therapists and psychiatrists, and a friend really helped me, who was also going through depression, but was actually getting help from medication. And I learned that because of her help and my therapist's help, I learned that medication was okay to take. And it really saved my family and myself. So fortunately, after the second postpartum and getting through that, it took about a year and a half. The family was at peace again and doing well and healthy. And the kids, after high school, my youngest son started pretty much overnight, came down with symptoms of schizophrenia. And it was quite a shock to all of us. We took him to our doctor, the family doctor, and it was really hard to hear that our son was experiencing schizophrenia. And we felt very lost and in shock for quite a while. After his first behavioral hospital visit, we were given a packet of brochures, and fortunately one of them was from NAMI, the National Alliance on Mental Illness, and it's a national organization that was started, I think, back in the 50s to help families and loved ones and the peers have support, especially when all the institutions were closed years ago. So we hung on to that brochure, even though we were still in shock. And it took about a year and a half to finally realize that we could go to a class called Family to Family, and it helped us feel less alone. We met other people that were going through similar experiences, and our son was being treated by a private psychiatrist at the time, who was fortunately amazing and worked well with our son. And it took about 2.5 to 3 years of a lot of stress and feeling a bit lost until we finally kind of saw a light at the end of the tunnel. But yeah, the behavioral hospital visits were difficult, but we have learned since then how to maneuver them. And I can share more about that later, possibly.
Okay, great. Yeah. I guess I would add, as I listened to both you and Jennifer talking, that, those years leading up involve a lot of traumatic experiences too. Just, not understanding the
Yes.
system, not knowing the right things to do. And that's a big part of why we're here today talking about this, hoping that we can help others who might need to use the mental health crisis system to be prepared and know more about how to navigate it. So with that, I really want to welcome you, James, and invite you to help us understand and give us an overview of like the current mental health crisis response systems and what's available here in Santa Cruz County, and what would be important for people to know about the differences between whether it's a youth or an adult utilizing those services. I know that's a big question.
It is, and it's a very layered response that we have. And I think the most important thing is that when someone's life is at risk, we might refer to that as danger to self, danger to others, grave disability. That's going to be an emergency call to 911, and that'll activate law enforcement, and hopefully our mental health liaisons will be able to respond with law enforcement in certain jurisdictions throughout the county. That is the highest level of crisis response. The next one would be things aren't going well, but I'm confused and I don't know what to do. And I would highly recommend utilizing our access team services. And that's through the County of Santa Cruz Behavioral Health Department. And that can be accessed through 800-952-2335. The next step down from that would be, if you're in somewhat of a good space, but knowing things are not right, is to review your health insurance referral for your group medical insurance. All medical insurances now have some form of mental health care attached to them. And so again, if we can get that before it gets to that huge crisis moment, there are some various services there where they'll get you in right away into the appropriate place. Also in the county, we have our mobile emergency response team, which will respond to crisis events at secure locations. So facilities and program treatment places. So that would be
And
hospitals.
schools, right?
Schools, correct.
Mm-hmm.
When we have school, pre and hopefully post 2020, they will respond to the schools again. And so, yes, that's kind of the very layers of crisis response that we have here in Santa Cruz.
Okay, great. Thank you so much. Is there important things that listeners should know about how those services may have been changed in the conditions of the pandemic? And if so, how have they been changed?
I think when it comes to crisis, we're trying to be a little more cautious about how we respond, but it's a crisis, so we still are responding. Again, within behavioral health, we have kind of a three-tiered response. We'd prefer to do telehealth if at all possible. If we can't do telehealth and it's practical, we'll do by telephone without the video. And then the third level, of course, is if it's imminent and an emergent need, we're going to show up in person. And so again, if you have to utilize 911, we're going to show up in person. How the COVID pandemic has affected us, though, is that from week to week, day to day even, it can affect our staffing. It can affect program sites. A COVID positive test at some of our residential treatment programs can mean that there's no entrance or exit from the site for a couple weeks while they're quarantining it. And again, it can affect our staffing, which can, again, impair our response to the community.
So all the more important during the pandemic that people try to utilize those lower levels of service prior to getting to an emergency.
Correct.
Yeah. And in addition to the things you mentioned, there's also a number of crisis lines. Do you want to talk about those at all?
Yes. There is such things as Suicide Prevention Service has a local crisis line. It is not just for folks that are considering suicide. It is for anyone that's in a crisis moment that is overwhelming them. There are also, NAMI has a warm line, and then also along the National Suicide Prevention Service has a texting line, 741-741. Obviously, you asked a question about youth earlier. Youth don't call on the phone anymore, they text everything. So that 741-741 is a good number to pass along to folks. And then also for drop-in center, again, it is affected by the COVID pandemic, but Mental Health Client Action Network also has some resources that are very helpful and supportive to folks in the community.
You're tuned to listener-supported 90.7 FM KSQD Santa Cruz, K-Squid, many voices, one station. And this is State of Mind, being human and living well. I'm your host, Deborah Sloss, and I'm here talking with mental health crisis response expert James Russell and volunteer mental health advocates Jennifer Wentworth and Kathy Pereira, who both have firsthand experience using mental health crisis services. We're discussing the services available here in our community, ways to access them, and how to be prepared in order to have the most successful outcomes possible. Stay with us to learn more, and we'll be right back after this brief message from our underwriter.
KSQD thanks Family Service Agency of the Central Coast for supporting this program. Family Service Agency provides counseling and support for people of all ages facing life crises and challenges. You can reach them at 423-9444 to see if they can help you. Thank you, Family Service Agency of the Central Coast, for supporting KSQD 90.7 FM.
Now, back to our interview. Coming back from the break, I want to come back to you, Jennifer, and You know, it sounds like you had just tremendous experience with mental health crisis services. And I'm wondering, from all that you've gone through, what went well and why, and what could have gone better and why?
Well, like you said, Deborah, I previously said I've had over 150 psychiatric hospitalizations. So there's been quite a bit of traumatic experiences related to law enforcement, and there's been some very positive experiences. I would say probably the most successful experiences I had were when law enforcement was accompanied by a mental health professional somehow. When I was utilizing the services, it was Encompass that was coming out. It sounds like it might be the county now. And I also had very positive experiences when law enforcement were CIT trained, which stands for Crisis Intervention Training. And having those police officers approach me in a non-aggressive manner and spending as much time as they possibly could treating me like I was a person that was having an episode of an illness, a no-fault brain illness, as opposed to treating me like a criminal. Those things were very positive. So the things that helped were the professional mental health workers, the crisis intervention trained officers, and being able to tell the people, the dispatchers, what was going on. If I had someone ahead of time, being able to share with them what my symptoms were and what could help me the best, that was very successful also.
Thank you. Thank you so much. Kathy, I know you too have had a lot of experience with the mental health crisis services, and I'm wondering from your experience, what did you find what helped make it go either well or not so well? What made the difference?
Well, yes. About 11 years ago, our son was experiencing some pretty difficult symptoms. He wasn't able to talk to us or stay grounded, and he was extremely agitated, and we realized he needed to get to the hospital. And from experience, we had heard from others actually tell us that it would be good to call 911 and have him evaluated at a hospital. And so we made our first call to 911 in Los Gatos, and we were extremely nervous about calling. We were embarrassed because the neighbors would probably wonder why we had police there. It was scary. We didn't know how they were going to treat our son and treat us. But we made the call anyway, and we were surprised to find that the police officers were very calm and very calm with our son. They were listening to him. They were listening to us. They were letting us share our stories, and everything went real smoothly. And before we knew it, our son was in the back seat of their car, headed to the hospital. And we had to ask what just happened. We weren't expecting it to go this smoothly. You guys were so calm. And they said, oh, we just finished our CIT training. And it was the crisis intervention training that all the Santa Clara County police officers were taking at the time. So we were very appreciative and felt very fortunate that things went so calmly. We've had to call police officers since, and have had some positive experiences, fortunately, because of the CIT training. It seems that when we got to Santa Cruz, they were in the process of training the officers here as well. And we were very grateful for that. So I think just having the calm presence and experience that these officers get at the training has just really been a success.
Thank you. Yeah, really important, I think, as much information as you can give. And hearing, both of your descriptions, it makes me want to turn to James and say, a couple of things, James. First off, could you help our listeners understand what are the situations where it warrants a call to 911 for crisis support? And, as you listen to Jennifer and Kathy's experiences, maybe you could describe some of the kinds of things that people see when when it comes time to call 911. I have my own experience with some clients is it's a really hard decision to make. And it gets, when things are really heightened and scary, it's a hard one to make. So it's helpful to think about that ahead of time.
Yes, and I think that what you just said there, thinking about it ahead of time. And again, I think as a society, we're not really ready for crisis. We're not really well informed with mental health issues that people face. And the more that we can educate ourselves around that, again, NAMI has some excellent classes. Mental health first aid provides some excellent training. And these things can help us become familiar with, oh, that person over there isn't actually in crisis. I see that they're talking to themselves, but that can actually be okay. And as a matter of fact, case in point, if someone had their cell phone in their ear and they're talking on their phone, nobody would think anything of it, right? But if someone's talking on their cell phone, crying and screaming into the cell phone, or has similar body language that indicates they're in crisis, you might want to stop and say, hey, are you okay? And so again, there's telltale signs that if we can educate ourselves on and become more familiar with it instead of being afraid. And again, I'm not advocating that someone go running up to anybody on the street to say, hey, are you okay? Without first making sure things are safe. I think that, again, our bodies tell us things in certain situations. Our bodies tell us that, oh, this might not be safe. Maybe I can do it from over here. And I can tell that this person might need some help. And I just want to alert 911 or someone else, even a non-emergency line. So again, 911, we prefer to use when it is an imminent risk to someone's safety, whether that's your family members or someone out on the street or your own. And when you call, that you have the best information you can to provide to them, the location that you're at, the circumstances, a good description of what's happening so that the 911 dispatcher can give the best description to the officers responding.
What kinds of things, for people in their homes, let's say, where it's happening with a family member, what kinds of things might they be seeing that it's time to call 911? So that's one of the things, because I think it's hard to judge that with someone that you're close to.
Yes. Boy, that first answer, I think all of us have different thresholds for stress and other things, and knowing your loved one, knowing what their threshold is. Jennifer's mentioned some things already about her relationships with other folks that they know. They've communicated this so that they know when to call 911, and same with Kathy and her family. So that communication in advance so that you know where those fine lines are, that, oh, we're in crisis mode right now. And that that now's the time to call 911. Or again, if we can stop before we get to the 911 call and get that person to a safer place or a safer situation and circumvent that whole process. Again, what Jen was talking about, that sense of autonomy and decision-making and taking control of what's happening to me right now and participating with this other helper and getting the right assistance. And so, but that 911 call, I think, is very difficult. I've talked with a lot of family members, and exactly what Kathy was saying, it was one of the hardest calls that they had to make, and they were very, very difficult thing, not knowing what's going to happen, who's going to respond, how are they going to respond. So again, making sure that you've communicated that we are in a mental health crisis right now. This is a mental health related issue, but there are some signs and symptoms of this and that going on, and we need someone over here now to intervene.
Yeah, thank you. So you've mentioned mental health first aid, and I'm wondering if you could just, what is that, and what should our listeners know about that?
Yeah, so mental health first aid is a training, it's an 8-hour training that goes over signs and symptoms of mental health related disorders, as well as when someone enters into a crisis situation, how you might be able to safely intervene with them. There's two different tracks. One's for adults, one's for juveniles or children. And so really good training. We've had some pretty good reviews here. We were introducing it into the county system just prior to COVID. And so they are doing a hybrid training now where it is online. I'm not too familiar with that. I'm more familiar with the in-person instruction, and I hope we can get back to in-person instruction. But for right now, it is out there. There are some online trainings available with it. And if you just Google mental health first aid, you'll be able to get on track with that.
You're tuned to listener-supported 90.7 FM KSQD K-Squid, many voices, one station. And this is State of Mind, being human and living well. We're also live streaming over the web at ksqd.org. And you can find all the podcast episodes of our shows on Apple and Google Podcasts and on the KSQD website. I'm your host, Deborah Sloss, and I'm here talking with mental health crisis response expert James Russell and volunteer mental health advocates Jennifer Wentworth and Kathy Pereira, who both have firsthand experience using mental health crisis services. We're here talking about the mental health crisis services available here in our community, how people can access them, and what you should know if you need to use them. Our guests are sharing from their personal experiences and from their professional expertise. I want to remind listeners that every State of Mind show has a resource list posted along with the show, and the resources we talk about today can be found on the post for today's show at ksqd.org/state-of-mind/. Now back to our interview. So coming back from the break, I want to just come back to you, Jennifer, and ask, you've been through so much, and you've sort of alluded to the fact that at this point you've become prepared for mental health crisis. So I'm curious how what have you done to prepare, and how's that preparation helped you?
Well, everybody is in a different place in their recovery journey, and sometimes it takes quite a significant amount of time to get a correct diagnosis and get correct medications. I mean, throughout my accessing crisis services for so many years, I was court ordered many times throughout those years for treatment. And sometimes it takes a long time to, like I said, get the right medications. And I know for me, when I've switched medications, there's a very high possibility, and oftentimes I've become unstable during that because I don't know, my psychiatrist doesn't know right off the bat what's the right dose for me. And sometimes during those extreme states of manic or depressions, whether for my safety because I was suicidal or I was in need of acute observation in the hospital. And sometimes people are also going through grief process, the grief process I know I did about accepting that I have a serious mental illness. So I wasn't willing to take medications for a long time. And then when I was okay with that, I thought, well, I don't actually need medications. I can do this on my own. And all of those things created a frequent increase in crisis and utilizing crisis services. Eventually, I wanted to make my own choices, and I really put a lot of effort into education and learning my symptoms well. And so I could feel empowered and not have to continually have the court system taking away my autonomy, basically. So, but sometimes that does happen. I mean, we haven't figured out where we are in our journey or what we still end up having to use crisis services, and I did for over 10 years.
Yeah, and from what I understand, James, maybe you can add to that, but I understand that's not uncommon, and for youth, it often can take also a very long time because they're changing and growing, and diagnosis is hard, and getting accurate medication for getting the right medication for the accurate diagnosis is a trick. Kathy, I want to ask you too, from your experience, why was it necessary to use mental health crisis services?
Well, it was usually important to use this service when our son decided to go off his meds. Like Jennifer and James were commenting on, it can take a while for some to accept that they have this illness, and a lot of times it's because unawareness is a condition that's common in about 50% of people with mental illness. And Brent, our son has just now started to accept, after 11 years, that he needs to stay on his medication if he wants to stay grounded and deal with daily life and enjoy the things he loves to do. So that's normally when we would need to call, when he was off his meds and just his symptoms took over. He wasn't able to function and communicate very well. He was off in a totally another world, and sometimes it wasn't a happy place. He was very agitated and in a lot of pain. So that's when we would need to call.
Thank you. So, I mean, both of you here are talking somewhat in past tense. So you've moved into a new phase, Kathy and Jennifer, and I want to ask you, what has helped you move into this phase of mental health recovery and reduced your need for mental health crisis services?
Yeah, sure. It was kind of a little bit of bad experiences. Well, I could say a lot of bad experiences and a lot of good supportive experiences. There is some motivation for me being locked up involuntarily in psychiatric hospitals 100 times or more, where, I mean, after 10 years, I'm just tired of, honestly, I felt like my entire 20s were robbed by my mental illness, and that was sad. But, but it also motivated me, to get control of my mental health and so that I could make my own choices, get off court-ordered treatment. And I too accepted that I have to take medications. Now I can choose, working together with my psychiatrist, choose medications that will help me and at what doses work for me. But I wanted to ultimately be the one making that choice. And so some of those really negative experiences, including not always having inpatient mental health professionals, they didn't always have my best interest in mind. Sometimes I just felt like they just didn't want to deal with me. So those negative experiences motivated me, and some of the positive influences that have motivated me have been NAMI Santa Cruz, the peer-to-peer class, finding other people who are like me that have serious mental illness, and they have been inspirational in the way that they're living their life and they're out of the hospital, and that motivated me also. And also attending a program here in Santa Cruz County called Community Connection, that was also a tremendous support and positive influence. There's a lot of peers that go there, and we learned a lot in the group classes about wellness and other ways to prevent mental health crisis. And if it's not entirely preventable, it's going to happen at some point again, but to be prepared for that for the future. So those are the positive influences that have helped me move into more recovery and not be in crisis every 3 or 4 months. And I'm very proud. I've been out of the hospital for 2.5 years now, and that's a long time.
Amazing.
Congratulations. Thank you.
Yeah.
Kathy, did you want to take a shot at that question and just about,
Sure.
What helped you and your family turn toward recovery?
Well, I think education has always been a big part of it. For me, when I was having the symptoms and the struggles with postpartum, educating myself and sharing that with my family really, really helped. And our son, I know for my husband and I, and my son's brother, our other son, we've educated ourselves, been committed to help others through NAMI and learn more. If there's more to learn through speaker meetings that they have every couple of months from professionals, it's just really helped, and it's helped break the stigma that we have felt, um, and it's helped us become more open. And I think that's helped our son. He sees that we can easily discuss, what's going on out there, and what's going on with him. He can always come to us and share if something's bothering him, and he sees us helping other families and friends who are struggling, and he's starting to break his own stigma that he feels, and I think that's helped his recovery quite a bit.
Yeah, and I remember when we were talking, getting ready for the show, you had also mentioned about putting your husband in a particular position to be able to help you. Did you want to talk about that at all?
Yes, that is the mental health power of attorney. And it's something that we fill out together, and it's state by state. Each state has their own power of attorney. And I am basically assigning him as my agent. This is something I fill out when I'm well, when I'm not having symptoms, and it's a plan for, this is he's the person that I'm assigning as my agent to make these decisions when I'm not well. And the goal is to have him make the decisions that I would want when when I'm not well. So unless there's something I haven't specified, but it's a plan of these are the kind of medications I don't want to take and why. And I want my agent, my husband, to be informed if I happen to be put into seclusion or restraints at any time, things like that.
I know too, earlier when you and I were talking in preparation, you had mentioned something about a family information form. Did you want to talk about that here, about when your loved one does go into a facility, how you can help communicate some of that important information about their history and background?
Absolutely. We learn through NAMI, and it's on their website as well, under the resource tab. There is a form you could fill out where you are able to share all the information about your loved one and give all the contact information to the facility. The doctor will have all the information about what medication your loved one's on. The doctors that he sees, their information. It's a very helpful form. You answer so many questions, and so they have this whole history about your loved one.
It's my understanding that's something people would prepare ahead of time, right? So that when a crisis emerges, you have that mostly ready and maybe just look it over and can update a couple of things and send it along if the person is taken. Is that correct, James? Is that how that works?
Yes, it is something that the officers can take with them and provide to the receiving facility. And again, this makes it so much easier to connect the dots on a lot of things. Oh, this is who your doctor is. Oh, this is who your treatment provider, and et cetera, et cetera. And we can double check the meds and stuff. And so these are a really great document. And something else we were talking about before was that if, as a family member or loved one, you're trying to call in information to one of these crisis centers or to even behavioral health with some important information, if they, one of the things that we is a roadblock sometimes to communication is HIPAA or privacy and confidentiality. When we seek medical or mental health services, we have it's not privy to other people. It's confidential. And so as a mental health provider, I cannot answer questions of a personal nature about a client. I can't confirm or deny that they're a client. However, if you're calling up to behavioral health or to one of these crisis centers, and you know that they're there, you can always say, I know that you can't confirm or deny that my loved one's there. However, I know they are, and I need to provide you some information about their care that's very relevant. It might be what their diagnosis is, it might be what their medications are, it might be who their treatment provider is. It might even be something such as their key is underneath the door for when they get home. That's actually something pretty significant. You know, when someone is taken to a crisis center and they're going to be released, how do they get back into their house? You know, they might not have brought their keys with them. That can be a whole nother set of stressors for an individual. So again, connecting these dots is really important and knowing how to do them. And so again, the NAMI education is really important for learning how to talk to providers, because we're our own little beast of ourselves, you know.
You're tuned to listener-supported 90.7 FM KSQD K-Squid, community radio for the Monterey Bay. And this is State of Mind, being human and living well. We're also live streaming over the web at ksqd.org. I'm your host, Deborah Sloss, and I'm here talking with mental health crisis response expert James Russell and volunteer mental health advocates Jennifer Wentworth and Kathy Pereira, who are sharing their own firsthand lived experience of using mental health crisis services. We're discussing the services available here in our community, ways to access them, and how to be prepared in order to have the most successful outcomes possible. Stay with us to learn more, and we'll be right back after this brief message from our underwriter.
KSQD thanks the California Youth Crisis Line for supporting State of Mind. California Youth Crisis Line provides confidential, compassionate crisis counseling and local resources 24/7 to youth ages 12 to 24 and their families via text or call at 1-800-843-5200. That's 1-800-843-5200. Thank you, California Youth Crisis Line, for supporting community radio. K-Squid, 90.7 FM.
Now back to our interview. You know, each of you comes with so much experience, each in your own unique way, and I'm wondering if you had one piece of advice that you'd want to offer to our listeners. You know, what would you want them to know? Jennifer?
Sure. I got a couple more than just one, but I would have to say, you know, definitely trying to work together as a family, if you can, or have a trusted ally, because they're really important. When you go into the hospital, it's nice to have somebody who's got your back, who has your best interest in mind on the outside, who can check up and make sure your needs are being met. I also, like Kathy said, getting educated with NAMI, the family to family class. And that's going to help the family member better understand what their loved one's going through. And the peer-to-peer class, that was pivotal, very important part of my recovery. And that helped me to reduce and eliminate that internalized stigma that I had. I had that internalized stigma as a result of how the community, how law enforcement, how society, how doctors, how they treated me. And so that was important. Also being able to have those plans ahead of time, the mental health power of attorney, and all of those things can prepare you for crisis. That's what I would say.
Thank you. Kathy, do you want to share what advice you might offer?
If there was one thing, it would be to make that first phone call, and don't be afraid, just do it. Just make the phone call, reach out. You'll be directed and helped and supported more than you know.
James.
Yeah, I think on my end, it's just simple slogan: if at first you don't succeed, try again. This is your life, your recovery, your family's life and recovery, and don't give up. If something doesn't work, try something or someone else. If this psychiatrist doesn't work, ask for another psychiatrist. If this therapist doesn't work, ask for another one. And so again, don't give up. I think that one of the things I got from both Jen and Kathy is that this was a process. Wasn't a one and done, everything's all better situation. It was, they didn't give up. They just kept going and trying to get better.
Thank you. Okay, we're coming to the end of our time here, and I want to ask each of you if there are any specific resources that we haven't yet talked about that you might want to share with our listeners. Jennifer, how about we start with you?
Okay, sure. Well, one of the things that I have been doing since 2013 is I've been writing a mental health recovery blog, and it's been helpful for me, but I initially started it so that other people could hear my experiences and what has helped me. And so I'm always writing about coping skills and different things I've learned and resources. And it's called A Day in the Life of Being Bipolar. And it's www.adainthelifeofbeingbipolar.wordpress.com. And having that as a resource, as well as this amazing pamphlet from NAMI National, Navigating a Mental Health Crisis, a NAMI resource guide for those experiencing a mental health emergency, the Wellness Recovery Action Plan, and the Mental Health Power of Attorney have been great to have.
I need to jump in here because Jennifer had so much good information to share that we just couldn't fit it all in. So I want to highlight here her mention of her WRAP plan. This is a wellness recovery action plan that helps people grow awareness about their own mental illness. They identify symptoms, warning signs, and coping strategies. It helps them make specific plans for how to take care of themselves, when and how to get help and support, and it provides a roadmap for averting crisis. She shared that creating and maintaining this plan has been key to her mental health recovery, and that this goes hand in hand with the power of attorney document she discussed. You can find more information and a template in the resources posted with this show. Back to Jennifer.
And then also finding those programs like James said, MH Can, that was mentioned a couple times, and Community Connection. MH Can is a resource for anyone, regardless of what their situation, their insurance is. And Community Connection is more specifically for people who are receiving treatment at Santa Cruz County Mental Health, and they have Medi-Cal.
Great. Thank you so much. And I do want to give a little plug for your blog because I got to take a look at it the other day, and it's really incredible the things that you share and the topics that you cover that would really help support mental health recovery for people going through it.
Thank you.
Yeah. Kathy, did you have any that you wanted to share?
Sure. And Jen mentioned Community Connections, and they've helped our son get a volunteer job just recently that he really loves. So that's a great place in the county, as well as the NAMI scc.org website that has so many resources and information, and it lets you know about the classes coming up and support groups for peers and family and friends. And the book, I Am Not Sick, I Don't Need Help by Xavier Amador. It should be listed, I'm sure, on your reference sheet. That is also going to help with communicating with your loved one when they're not feeling well and having major symptoms. So that's a great book too.
Thank you, Kathy. We'll make sure all those links are up posted with the show. And I just want to mention that on the NAMI Santa Cruz website, there is a very specific brochure called that's been developed locally called Calling 911. And it's a quick reference guide for people to have and be prepared in case they have to call 911 for a loved one around a mental health illness. And it really gives some good tips and guidelines. And we'll make sure there's a link for that there too. James, is there anything you would like to add?
I just would encourage everyone to, whatever your insurance is to investigate with your insurance what type of mental health resources does it provide for, so that you're aware of it in advance if something ever should rise up that you need to access that. And then in addition to that, just remember our county access team can be contacted at 800-952-2335.
Great. And then we also will make sure that mental health first aid, that there's a link to that as well, James. You had mentioned that earlier. So as we come to the end of our time, is there any closing thoughts you'd like to leave our listeners with? Jennifer?
Yeah, I just want to say that throughout my journey of recovery, there was so many times that I almost gave up hope. I wanted to give up hope. I didn't have hope, and I didn't ever think I would be in recovery. I thought it was just going to be like this crisis the rest of my life. And so, like James said earlier, don't give up hope, because I mean, after all the years of utilizing all these resources we've talked about, it's helped me feel like I'm in charge of my life now. And yes, I accept I have a serious mental illness. I'll probably have to take medications the rest of my life, but I know I can have a productive and good life, and so can everyone else that has a mental health challenge.
Thank you. Kathy, any closing comments?
Yes, thanks, Deborah. I want to share, the main thing I want to share is that you're not alone. There's so much support out there, and you'll get through this. There will be a light at the end of the tunnel. It may take some time, but yes, you're not alone. You don't have to be alone.
Thank you. James?
I just hope that through programs like this and other mental health awareness advocacy groups, that we can continue to partner across our community, that we can really become a community of MBs instead of NIMBYs, that we want people in our backyard and are welcoming and understanding and compassionate.
Thank you. That's the community I want to live in too.
Mm-hmm.
Yeah. Well, I can't thank you all enough for being here with us today and for sharing all your wealth of hard-earned experience and wisdom. It's just been incredible. Thank you.
Thank you, Deborah.
Yeah,
Thank you,
great.
Deborah.
This is Deborah Sloss, and I want to say a huge thank you to our guests today, Jennifer Wentworth, Kathy Pereira, and James Russell. And thanks to you for joining us here on State of Mind, Being Human and Living Well. To hear more conversations about mental health and wellness, join us on the first Sunday of every month from 6 to 7 p.m. right here at K-Squid, 90.7 FM. Special thanks to Jeannie Baldzikowski for audio production and to Jennifer Young, who assists with research, and thanks to acoustic guitarist Adrian Legg for composing, performing, and donating the use of our theme music. You can find all the podcast episodes of this show on our ksqd.org website by typing State of Mind in the search bar, or subscribe and get them delivered directly to your listening device on either Apple or Google Podcasts. Or listen through your home smart speaker by saying, play State of Mind podcast with Deborah Sloss on TuneIn. This is listener-supported community radio, so that means we want and we need to hear from you. If you like this or any previous State of Mind episodes, please help the shows get found and heard by more listeners by leaving us a rating and a review on Apple and Google Podcasts. It really does help. This is KSQD Santa Cruz. Just remember, 90.7 FM, K-Squid, your ink spot on the dial. Stay with us.